everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to go over what to consider when you are buying a stethoscope. As a nursing student or nurse, there are so many options for whenever you're buying one of these. There's so many different brands, so many different designs and styles. So in this three-part series, I'm going to go over here in this video, like I said, what to consider when you're buying one. In the next two videos, I'm going to go over different types of stethoscopes and show you pictures and show you what you can get, what is available on the market, and give you some of my opinion on what you should avoid maybe as a nursing student compared to a nurse. And then I'm going to go over the top brands that most nursing students and nurses go with that they really like. So hopefully that can help you decide and in your decision whenever you're going to get your stethoscope. So first, let's talk about what to consider when you're buying one of these. Okay, the first thing I want to start out with is the saying, always try before you buy. A lot of times with the stethoscopes, one person may hear perfectly out of a Littmann stethoscope, while another person may hear better out of a Prestige stethoscope. And the reason is, this happened to me. I hear better out of Prestige than I do Littmann, but my friend hears better out of a Littmann than she does with my Prestige. So I always recommend that you try a friend's stethoscope out in clinicals, or if you work in a healthcare setting, you try those out. Because there is not one stethoscope that is just perfect, that everyone absolutely loves and they can hear out of it. Everyone has issues with every stethoscope. And I think the reason is because everyone's ear canals are designed differently, and we hear different frequencies of sounds on different levels, and some stethoscopes may be sensitive to your hearing compared to someone else's. So you always want to try these things out before you do. And whenever you do it, recommend you take the stethoscope, of course clean it if it's someone else's stethoscope, just to decrease spreading germs with alcohol prep. Put it in your ears, see how it feels in your ears. Is that comfortable to you? And then take the chest piece and listen to heart and lung sounds, and what you're listening to is how well you can hear that sound. And you will see that with different stethoscopes you hear sounds differently. Okay, whenever you're doing that, you're looking at, of course, what we just said, the clarity of the sound and the comfort to your ears. And you're going to feel how heavy it is, because a lot of nurses, we like to wear our stethoscopes around our neck or carry them in our pocket. And you need to ask yourself, is this something that I can see myself wearing for a 12-hour shift? Because we want access to this immediately if we are in a patient's room and we see that they're not breathing right, or something funky's going on with their heart. We want to be able to listen and have access to it fast. So check the weight, make sure it's something you want. Then you want to pay attention to what type of material it is made out of. The rule of thumb, stainless steel is one of the best things on the market right now for the chest piece, because they tend to conduct the sounds better than other qualities. So you want to look at that. Make sure the tubing is holding up, especially if you're looking at your friends and if they've had it for a while. Ask them how long they've had it, and make sure it's not falling apart or it's frayed and things like that. So those are things you definitely want to look into. Okay, next, a lot of times when you buy a stethoscope, the person who's selling it to you will offer free engraving or a name tag, like how I have on this one, because these things will get stolen, especially if you have bought one that is expensive or name brand. It's like there's certain people out there that look for these stethoscopes and they steal them and take them home and sell them maybe on eBay or something like that. So you want to make sure that you're putting your name on it, so it'll be harder for someone to steal it. I have heard of multiple stories of people losing their stethoscopes because they left it at work, and then the next time they came back for their shift, it was gone, even though it was in like the locker area. And third, you want to ask yourself, why am I buying this stethoscope? Where am I right now in my nursing career? For instance, are you a nursing student who is just beginning? You really don't know the difference with lung sound, the different types of lung sounds, different types of heart sounds, and you're a novice at it. I recommend that you go with a midline type of stethoscope, which I'll go over that in my third video. Or are you right now, you're already done with nursing school, you are familiar with those sounds, and you are going to be getting a job in the ICU or cardiac nursing? I recommend that you go with a higher line stethoscope, because a nurse who is working in the ICU and cardiac, they really need a sensitive stethoscope made with some of the best materials, and it's a cardiac line, so you can hear those ectopic heart sounds, those little subtle changes that you may not pick up with just a midline stethoscope. And also, if you're going to be working in clinic nursing, you probably don't need a big fancy stethoscope compared to someone who's going to be working in the ICU or cardiac nursing, because in the clinic, you're mainly taking blood pressures, you having patients come in, you're listening to their heart and lung sounds, but they're not going to be as sick usually as compared to someone who's in the ICU who's really, really sick. So always ask yourself that before you fork over that money, because these things can be expensive. Okay, last but not least, don't be fooled by the price. Don't fall into that trap like I did, thinking, well, this stethoscope for $200 must be better than this one for $80, because sometimes that's not true. I remember hearing of one time this nurse who had lost her stethoscope, actually someone had stole it. It was one of those really expensive Littman stethoscopes, the cardiology ones. I think she paid around $150 or so for it, and someone stole it, so she went to get another one. She wasn't going to spend as much money, spent maybe like $80 on it, and found out that she heard just as good and it worked just as great, the cheaper one compared to the expensive one. So always try a stethoscope out if you can before you buy it, and look at the reviews, see what other people are saying about it, and go by that. Do not go by just price alone. Okay, so be sure to watch my next videos, because this is a 3-part series. In the next video, I'm going to be covering different types of stethoscopes out there, so stay tuned for that. And then in the third video, I'm going to go over the top brands of stethoscopes for nurses and nursing students and give you my recommendation on what you should get. Thank you so much for watching, and be sure to subscribe to this YouTube channel.